Hello everyone, mabuhay! Welcome to today's international nursing webinar entitled The Viral Spread of Vaccine Hesitancy, Building Vaccine Confidence via Empathy and Narratives in the Philippines. My name is Luis Carlos Roderos, and I am one of your program in charge today, hosting right here at Cavite, Philippines. Together with me is Ms. Ria Maris Matel, a colleague from CVSU College of Nursing, Department of Medical Technology. Hi, ma'am.
Hello, sir. Hello, everyone. On behalf of the College of Nursing, we would like to welcome our participants from different institutions, private and government agencies, students, and faculties. Thank you for joining us today. We're very grateful and blessed that you lend us your precious time.
Well, before anything else, I would like to remind everyone that this webinar is being recorded. Keep your microphones on mute. This is to avoid any unnecessary background noise. Nevertheless, you can unmute yourselves during the open forum. You can also use the chat button at the lower section to ask questions, and it will be entertained later. We also like to encourage all of you to please help us spread what's happening and share today's webinar through your social media networks.
At the end of this webinar, we will be sending a link of the webinar evaluation form. It will be greatly appreciated if you could please complete our form, since all the feedback that we will receive will be greatly beneficial, as it will ensure that the future webinars will be relevant and would provide a collaborative, engaging, and interactive experience for our participants.
All right, we're all excited, but before we formally start our webinar proper, please join us and let us first unite in prayer to be led by Ms. Jocelyn A. Di Mayuga from College of Nursing, to be followed by the Philippine National Anthem.
Let's bow our head and place ourselves in the presence of the Lord. Heavenly Father, we praise and thank you for giving us a chance to be united today. Thank you for the opportunity to care for the world and the humanity that you have made. We ask you to bless our gatherings this day and favor us with your presence as we seek your guidance and hopes to further enrich our knowledge and strengthen our partnership. Steer our intentions to align with your will and multiply our efforts as only you can. Guide our hearts and minds as we listen to what our webinar speaker will be imparting us. Bless all the allied medical professionals at the front and protect them from this pandemic. This we pray in the holy mighty name of our Lord and Savior Jesus Christ. Amen.
Amen. To formally start with our webinar proper, let's all witness the national anthem. Thank you. All right, and as we formally begin our webinar proper, please help me introduce our fast and serious university president, of Cavite State University, Dr. Hernando D. Robles. Unfortunately, Dr. Robles will not be able to join us today due to an equally important event. And to present his message, may we call on the Dean of the College of Nursing, Dr. Evelyn M. Del Mundo.
Thank you. Pleasant day to all. On behalf of our Cavite State University President, Dr. Hernando D. Robles, who will not be able to join us due to equally important administrative and academic matters, I would like to welcome you all on this international webinar. Our president would like to appreciation first to Filipino Nursing Diaspora Network, the President CEO of FiND Network, Professor Violeta Lopez, and Dr. Maria Cynthia Lay, the Director for Professional Development. Dr. Jerome Babariat of FiND Society, our distinguished resource speaker, Dr. Mark Donald Reñosa, who will be introduced formally later. To the panel of reactors of different colleges and accredited professional organizations in nursing and education, and to all the participants all over the globe. This is the fourth webinar collaboration with FiND Network and the CBSU College of Nursing. Our president is really looking forward to more partnership with this organization. He added that the webinar topic for today, from a highly experienced public health specialist in global health research, is very timely since we are now having our focus on whether we are to have our vaccines or not. Surely, this will be a very fruitful day for all of us. Again, from our university president, Dr. Hernando D. Robles, a warm welcome, everyone, and God bless us all.
Thank you, Ma'am Evelyn. Now let's hear the opening remarks from the very supportive Vice President for Research and Extension, Dr. Melbourne Talaktak. Good day, sir.
Thank you, Ma'am Ria. Okay. So to my dear fellow university administrators, especially to Dr. Evelyn M. Del Mundo, Dean of the College of Nursing, deans and directors, faculty, staff, students, to our partners from Filipino Nursing Diaspora Network, and of course to our distinguished resource speaker, Dr. Mark Donald Reñosa, and panel of reactors. A pleasant good morning to all of us. In behalf of our university president, Dr. Hernando D. Robles, I welcome you all to this very timely and equally important webinar on the challenges of vaccine hesitancy in our country, especially for COVID-19. Vaccination has always been our go-to solution to resolve the health threats due to infectious agents like rubella or German measles, tetanus, hepatitis B, or even eradicating important diseases like smallpox and polio. Although in our country, sporadic cases of polio have been reported, but just last June 3, the Department of Health already declared that our country is already clear of polio outbreaks. So just the outbreak, but the polio is still there. However, despite the major success of vaccination to prevent humans and even animals from contracting specific diseases, our country is still struggling to achieve its goal of a herd immunity, or at least 70% of our population vaccinated against COVID-19. And as of June 16, 2021, 7.5 million Filipinos have already been vaccinated against the disease, and these numbers translate to less than 10% of our population. So we still have a long way to go, and I really hope that the ghost of Dengvaxia is already gone so that we can move forward in protecting our countrymen. So for this afternoon, I commend all the people from College of Nursing for initiating this webinar together with FiND to further increase awareness on the importance of vaccination and in building vaccine confidence in our country. So without further ado, let us all enjoy while learning, and without preempting the message of our resource speaker, may we all be part of the solution by being vaccinated against COVID. By getting vaccinated, you are not just protecting yourself, but also your loved ones and friends. Thank you, and may God bless us all.
Thank you, Dr. Melbourne. I agree. Let's be all part of the solution. And well, today, as mentioned earlier, we are just so thrilled because this is the fourth collaborative project of Cavite State University College of Nursing with the Filipino Nursing Diaspora Network.
Founded in 2018, the network is based in Sydney, Australia, and is an international professional organization serving the Filipino nurses who are working and living outside of the Philippines. The aims of these seminars or webinars are to share insights, updates, and state-of-the-art knowledge from Filipino nursing researchers, to inspire with success stories from around the nursing diaspora world, and finally, to build capacity and update about the latest development and science relating to nursing and health.
Again, this webinar entitled The Viral Spread of Vaccine Hesitancy, Building Vaccine Confidence via Empathy and Narratives in the Philippines is an initiative of the FiND Network in collaboration with Cavite State University College of Nursing with, of course, the following objectives. First is to abreast the participants and attendees on the issues about importance of vaccines and discuss or share the professional experiences of our resource speaker pertaining to the viral spread of vaccine hesitancy in the Philippines. And of course, we also aim to build alliance and partnership to strengthen the College of Nursing linkages among external healthcare and international academic organizations.
At this point, I would like to call in again the always passionate and very supportive Dean of the College of Nursing, Dr. Evelyn M. Del Mundo, to introduce our webinar speaker for today.
Good day, ma'am.
Hello. Thank you, Ma'am Ria and Sir Luis. To our university president and Dr. Hernando D. Robles, to the CEO and President of Filipino Nursing Diaspora, Professor Violeta Lopez, Dr. Maria Cynthia Lay, Director for Professional Development, FiND Network, to our Vice President for Research and Extension, Dr. Melbourne Talaktak, Dr. Jerome Babate, Secretariat of FiND Society, to our two guest reactors, Mr. Laurence A. Figueroa and Ms. Karen Krista M. Escobar, to all deans, administrators, and directors of different colleges in CBSU and other schools, university, nursing and educational organizations, students, parents, stakeholders, to all our participants all over the world. A pleasant day to all. It is my great honor for me to introduce our speaker for today, who is going to talk to us about the viral spread of vaccine hesitancy, building vaccine confidence via empathy and narratives in the Philippines. This is a topic in which we should all be deeply interested because it focuses on the issues and trends pertaining to vaccines. Our speaker is a highly experienced public health specialist with 10 years in global health research, with special focus on infectious and neglected tropical diseases, including clinical trials on vaccines, and evaluation of health programs. His research interests are on the development of global health interventions using human-centered design, implementation research, epidemiology, and biostatistics, and on research with special focus on tackling social determinants of health. He graduated his Bachelor of Science in Nursing in 2009 and Doctor of Nursing Science in 2014, both in St. Paul University, Philippines. Then he had started his Master of Arts in Health Policy Studies in the University of the Philippines, Manila, College of Public Health. Took a leave to finish his Master of Science in International Health as a scholar of Ruprechts-Karls Universität Heidelberg Institute of Global Health in, in 2019. Currently taking his PhD in Global Health since 2020 on the same university as Scholar 2. To date, our webinar speaker is a senior science research specialist, epidemiology, and biostatistics in Research Institute for Tropical Medicine, Department of Health, Philippines from August 2010 up to present. With previous position held in the university as Research Specialist 1 and 2 and Clinical Research Manager Nurse, he became a principal investigator of many research projects. To name few includes Project Salubong, Building Vaccine Hesitancy via Empathy and Narratives in the Philippines, and so many others researches. At present, he works as an adjunct professor, master's and doctor program in St. Paul University, Philippines. And with his consultancy experiences, became a course facilitator and WHO DTR Regional Training Center. His international professional experiences were more on the conduct of researches in different universities in countries such as Thailand, China, and Japan. He speaks German language. He received many prestigious awards, to mention some: RITM International Publication in 2020, and Carlos Lischner Academy Share Auslander Gens a scholarship for her master's and PhD. At this time, our webinar speaker has 23 academic publications in high-impact journals of nursing. And recently, his professional membership includes course guest lectured in medical anthropology in Heidelberg University and peer reviewer in BMG Global Health. And our speaker has presented his research in South Korea, Indonesia, and Singapore. And without further ado, ladies and gentlemen, please join me in welcoming our webinar speaker, Dr. Mark Donald Reñosa. Let's give him a warm virtual applause.
Hello, good morning, everyone from Germany. Good afternoon, good evening from wherever you are. I hope that you are finding light amid the pandemic. So yeah, just a moment. I'll just be sharing my screen. Okay. So yeah, thank you very much to all especially for Professor Jerome Babate for introducing me and for linking me to this FiND network. And it's very wonderful and very amazing to be speaking in front of you today virtually. So I'll be talking more about the viral spread of vaccine hesitancy, which for the past 5 years, I've been studying how it spreads and how we can tackle the issue on vaccine hesitancy. So just a quick outline for today's presentation. we will be reviewing together the concept of vaccines and how it contributes to the eradication of diseases, and the concept and the phenomenon of vaccine hesitancy, and then a little bit of introduction on the current work that I lead in the Philippines, and our preliminary results on the reasons why caretakers and Filipinos in general delays or refuse vaccination. And lastly, we'll be concluding with some tips on how to reshape our vaccine conversations. Okay. So vaccines in general is considered one of the most leading public health achievements because it is highly cost effective, it is safe to prevent millions of deaths annually, and of course, it's responsible for the eradication of smallpox, its prevention of the lifelong disabilities of polio, and contributed a lot to the major reductions of childhood morbidity. Although vaccines represent a seminal or germinal achievement in terms of mitigating diseases, confidence in vaccines has decreased in many countries in recent years. This drop in confidence has contributed to stagnation or decreases in immunization rates, which in turn has resulted in outbreaks of previously controlled or domestically eliminated diseases such as the measles and polio. Today, we are in a paradoxical situation of having effective, safe vaccines, but doubting public. The shift from the notions of vaccines as saver of lives to a source of anxieties among families and individuals globally is predominantly emerging in literature. With these changes, the ground beneath vaccine confidence has also emerged. Vaccine hesitancy in 2019, the World Health Organization included it as in the list of 10 global health threats requiring high-level attention and research. It is defined actually as a delay in acceptance or refusal of vaccines despite availability of services. It's actually a continuum of attitudes and behaviors. Literature that has sought to tease out the causes of vaccine hesitancy emphasizes on 5 C's. First, a lack of confidence. Confidence specifically in vaccines and in the broader health system. So it means lack of confidence to your healthcare workers, lack of confidence to your health centers. There's also lack of complacency regarding the severity of vaccine preventable illnesses. And then third is lack of constraints. Constraints such as the barriers in getting the vaccines, such as psychological, financial, or structural or superstructural, such as if there's typhoon, if there's lack of transportation going to the health centers. So these are constraints. And then fourth is lack of calculation. Calculation in meaning this is the degree to which individuals search for information about vaccines, where to search information, what to search information, and how to digest those information. And lastly, there's a decreasing collective responsibility or the willingness to protect others. Okay, so this is actually very problematic. Okay, problematic, especially because there's a limited guidance on how to conduct vaccine hesitancy, and most of which stems from high-income countries. And This is problematic for the low middle income countries, especially particularly the Philippines, because first, majority of the world's vaccine preventable deaths occur in low middle income countries. Second, public health and immunization structures in low middle income countries are insufficiently equipped to address vaccine hesitancy while rolling out the national immunization campaigns and, of course, fielding other child health challenges. And lastly, in the event of an outbreak of a disease, like specifically like COVID-19, survival rates and containment possibilities are extremely reduced in low middle income countries where poor structural conditions and extreme poverty can exacerbate pre-existing vulnerabilities. And what makes it problematic now, according to Professor Heidi Larson, Professor Heidi Larson is one of the prominent leader of the Vaccine Confidence Project in London School of Hygiene Tropical Medicine. I'll just go back to the previous slide so that you can appreciate the continuum. Okay, so the debates around she talked about the debates surrounding vaccines, that these have been become entwined with geopolitical issues, as well as it's combined with political campaigns, religious and cultural issues, celebrity causes, and age-old devotion to Mother Nature over modern technology. So looking at the continuum, so it's here you can see from the left side, yeah, it's the left, yeah. Okay, there's an active demand. These are the ones who are confidently wanting the vaccines, and this is where we want to be. Okay, and along the continuum, going to the right, there's like extreme red, okay, from vaccine accepting to vaccine refusal. Okay, while some are merely hesitant. Okay, for example, there's a COVID-19 vaccine. You are hesitant, and it's okay to be hesitant. It's normal to be hesitant because it's the human nature. We ask uncomfortable questions, and it's okay to ask questions. It's okay to get information, for you to have that certain confidence to do decision making. Okay, so some in the middle, some are there is like a passive acceptance. Okay, so for example, there's a polio outbreak, so everyone wants to get polio vaccines for their kids because there's a pandemic or there's an epidemic or an outbreak. Okay, that's passive acceptance. Okay, some are merely in the vaccine hesitancy cohort or groups. Some are merely hesitant, yet continue to vaccinate. Those are like questioning vaccines. They have questions, but they still get it. Okay. Others are more extreme in their anti-sentiments, joining their vaccine views with other sentiments from, for example, environmental. These are people who were anti-chemical or sort of anti-mercury, to the range of anti-government control. So like there were like these conspiracy theories. Oh, the government is trying to control me. They're putting chips into my body. These vaccines are chips. Okay, my body, my choice movement. To anti-abortion and anti-migration, and even anti-migration, building constituencies well beyond vaccine circles. So these are what makes vaccine hesitancy intriguing, problematic, and exciting to study. Okay. So vaccine hesitancies in the Philippines, we are among the low middle income countries that really experiencing erosion of trust in childhood vaccination. And what makes it problematic is that we are 104 million populations and it's still increasing across more than 7,000 islands. So we have to think about logistics, like spread of disease, if there's outbreak, how to mobilize your vaccination, your vaccines, how to transport your vaccines to far-flung communities, islands, how to like logistically prepare your vaccines. Are there any refrigerators? Are there electricity? What if there's typhoon? So these are, I mean, these are contributory and drivers of what makes vaccine or the immunization problem really stressful in the Philippines. In 2018, after the Dengvaxia controversy, it's huge, and we were, I mean, all the global health lens is like focused in the Philippines because we are among the cases, one of the major case on vaccine hesitancy. In 2018, Heidi Larson and her study team studied looking at the vaccine confidence of among Filipino families and Filipino individuals in general. The result, the finding is very sad. Okay, our vaccine confidence has fallen from 93% strongly agreeing to the importance of the vaccine in 2015 to 32%. Like a huge drop in vaccine confidence. Okay, so you might be wondering, oh, okay, so this vaccine hesitancy is because of Dengvaxia. Dengvaxia has always been, has always been engraved into our minds, and it makes us anxious. Is it like COVID-19 vaccine? Is it another Dengvaxia vaccine or something like that? But you know, studying vaccine hesitancy for the past 5 years with my team in the Philippines and in Germany, we really we were fascinated that we have like the phenomenon of vaccine hesitancy is actually not new. It's actually in the beginning in the Philippines, yes, it started in 1990, but globally it started during 1850s during the smallpox. So looking at the archives, there were some rumors about like these are like government control. They're like giving you sort of something that can control the government can control your body, your decision making, and all of these things. But in the Philippines in 1990s, rumors circulated that tetanus toxoid vaccine can cause female infertility. And the problem, sorry, yeah, okay. So not only did the tetanus vaccine rumors affect the tetanus vaccine coverage, they affect confidence in other vaccines. In 1990s, the city government of Manila issued a temporary restraining order stopping the administration of tetanus vaccine, which coincided with the National Immunization Day for polio vaccination. So what happened is that even polio vaccination acceptance dropped from more than 90% to 35% due to widespread tetanus vaccine anxieties and waning distrust in the system. Okay. In 2019, if you could still remember the swine flu or the H1N1 pandemic, in the beginning, before like there's a news that the vaccine is coming, there's an H1N1 vaccine, and then suddenly the narratives changes. Like Filipinos wanted to like get the vaccines. They were excited. Like this is like the hope. Okay, hope that the pandemic will stop and then our fears will calm down because there is a new vaccine. But however, what made it interesting is that as soon as the vaccine was made available in the market, the vaccine uptake was less than optimal. So see, there is like still a vaccine anxiety. And in 2013, if you could still remember the human papilloma vaccine or virus vaccine, which was actually implemented as part of the school-based immunization, later on, we have like a public clamor, like parents, Department of Education, our Catholic Church has stopped wanting to stop the rollout of the vaccination, because it was viewed as somewhat teaching our students, our grade 4, grade 5 students, to be sexually active. The vaccine was actually viewed as sort of an avenue for sexual promiscuity. And 20 years later, looking at 1990s to 2016, 20 to 25 years later, the vaccine role rises, a controversy. Okay, 20 years later, a different vaccine scare around a new dengue vaccine similarly actually provoked a domino effect on waning confidence in multiple vaccines, as the Dengvaxia was believed to be linked to the deaths of school children, which, okay, there's like, I need to underline this and underscore this one, which was totally refuted by the public health scientists. It's not related, okay? But what happened is the confidence crisis contributed to a record high measles outbreak and the return of polio after 20 years of country being polio-free. Okay, so unlike measles outbreaks that have occurred in, for example, in sequestered communities elsewhere, okay, in other settings, outbreaks in the Philippines have occurred in both urban and rural areas across high and low income settings in geographically disparate islands and without regard for religious affiliation, which is something new, because in the case of other countries, usually in Kenya, there's a specific vaccine scare happened because the Catholic Church do not want to give this certain polio vaccine or tetanus vaccine because this can cause infertility, or this is a sort of contraception, something like that. So these has like a link to religious affiliation. But in our setting, this is without regard. Our outbreak is without regard for religious affiliation. If you look at our cases of measles outbreak, it's Calabarzon, it's Western Visayas and Davao region, and the National Capital Region, also Region 3. So while some have posited that the outbreaks are linked to health system weaknesses, like we are hearing some narratives like, because during that time, it's not all about dengue controversy, because during that time, the vaccine coverage is going down. So we should not just attribute everything to dengue vaccine, okay? While others emphasize the role of social media in turning parents against vaccines and thus spreading the disease. You have to understand that we are living in a situation where Facebook is like our news outlet. Twitter is like our news outlet. So everything is via online. And it's really hard for us to really distinguish what's the fake or what's the true news. So it needs like a really good sort of there's a wisdom on how to like really check on what's the right information. Okay, and now we are experiencing now in the beginning of 2020 the COVID-19 pandemic and its associated lockdowns. So in the beginning, you are looking at these challenges in PH immunization program. It's like 1990s, rumors circulated, and then there's polio outbreak. 20 years later, there's dengue, and then there's measles and polio outbreak. COVID-19 is some sort of same with what's happened in H1N1 vaccine. In the beginning, when we were talking to parents, like, hey, the vaccines are coming in. So do you want to get the vaccine? They were actually excited They're excited, like, oh, this is like a chance for us to go out and then to be normal again. However, when the vaccine started to roll out, we are seeing changes in the narrative. People are afraid of COVID-19 vaccines. They are choosing what specific brands. They are questioning the the pharmaceutical companies, from what specific country should I get this one, should I get not that one, and so on and so forth. Okay, so what we did was to, in partnership with the Heidelberg Institute of Global Health and funded by the Bill and Melinda Gates Foundation, we were able to get a funding to study on the narratives of the Filipino families and how to develop interventions. And we call it Project Salubong. Salubong is the moniker. Of course, we'll be questioning, "Oh, why Salubong?" Salubong is the moniker of our research. It is actually a Filipino term, means to welcome someone into one's home or life. Salubong has developed into a Filipino tradition that celebrates the beauty of reconnecting with important figures from one's past. Um, the Salubong tradition is commonly observed at international airports throughout the Philippines, where many Filipinos are waiting for their loved ones to return home after having sought employment abroad. You know, the diaspora has fostered an undertone of longing and anticipation in many Filipino homes. And we use that sentiment in our vaccine intervention. We aim in using that salubong moniker, we aim to signal to communities that unwelcoming vaccines into our homes or lives is a current dilemma, yes, like many of the life dilemmas. But in unwelcoming, there is a progression of re-welcoming. Salubong is intertwined with notions of acceptance, compassion, and understanding, and sends the message that we will not rely on an intervention that uses blunt tool of scientific reasons, of which excludes the population perceptions, particularly as this has proven ineffective in relation to vaccine hesitancy. Instead, we will employ human-centered design to develop an intervention together with weary families. So we want to talk to them, understand their perception, what are their fears, and then to encourage them to reconsider the childhood vaccination. It's like, I'm hearing you, I feel you, I understand you. Now let's turn the table. Okay, what will we do to help you get back to health centers, to go back to health centers and get and revive vaccines and make a decision to get vaccination. So this is actually the entire premise, the entire thesis of our research project. So, however, because of the COVID-19 pandemic, so if you wanted to read more of our project, so I shamelessly plugged in our recent publication. If you wanted to look at that and be inspired, okay, and however, during the pandemic, we started our project during pandemic, and of course, there's associated lockdowns, and our project is highly qualitative in nature. It's like sort of exploratory sequential mixed method. So the bulk of our data collection is via in-depth interviews, via focus group discussions, so highly qualitative. So we cannot do that. So we developed new operating procedures for conducting online data collection. So again, I'm plugging in our publication. If you wanted to get a feel on how we did the collection, or if some of you are doing research and having thoughts on how to really conduct a good qualitative to perform a good qualitative data collection amid the pandemic. Okay. So we gathered information about vaccination problems. we interviewed policymakers looking at their perspective on the past and current challenges on vaccination. And one of the salient themes that arise during our conversations with the policymakers is that there's still a politicization of the Dengvaxia controversy, which significantly disrupted decades of immunization work. Immunization work for our meaning our national immunization program, which composes of all these childhood vaccines, and of course, it has something to do also with the rollout of our COVID-19 vaccines. And there's a rampant disinformation through fear narratives in social media, especially during the Dengvaxia controversy. And the policymakers are really having, during the time of the Dengvaxia controversy, they are having really difficulty on how to do risk communication, how to stop, because it has been very new that there's a huge infodemic in social media, and once it's there, it's shared, it's liked, it's reposted, so you cannot really track and you cannot really do some sort of how to intervene. And you have to remember that we are looking at the continuum, right? The continuum. In the right most, there's this vaccine refusal. And sometimes those who refuse vaccines, it's really hard for you to really win them back. So rather than pushing all your intervention into them, put your efforts into those who have like questions, who have like fears, who have like anxieties. Address those, because you have to understand that those vaccine refusals have this some sort of cognitive bias. Whatever you say to me, I believe that it's not working. It's a government propaganda. This is like you are controlling people. These are like conspiracy theories and so on. So you have to understand when you develop your vaccine hesitancy intervention, you have to understand the different. You have to weigh in. You have to group them based on their vaccine hesitancy continuum. And lastly, COVID-19 lockdowns halted immunization programs and kept families from adhering to vaccination schedules. But it's Department of Health, especially the vaccination, the National Immunization Program, is amazing and did a very wonderful job, because we were able to stop the outbreak, the polio outbreak. So the house-to-house campaign is really commendable. The effort amid the pandemic is highly commendable, and we have to like salute our Department of Health, our national immunization program with that success. Okay, and this is very interesting, and I really loved it. This is like coming. We were able to our publication. We submitted our manuscript to British Medical Journal, and this will be coming out very soon. And we interviewed caregivers of small children, especially those vaccine hesitant. Okay, understanding the reasons why they refuse or delay their childhood vaccination. And this is one of the striking salient quotes that we get. Okay, so Crean is a mother of 3. Okay, my child was healthy, he was fat, but when we started taking vaccines, he had recurring fevers. I did not know why suddenly he became so sickly. So these are the reasons why she opted out to vaccine, because of side effects. Okay, and then on Princess, on the other hand, it is difficult if every time I insist about vaccination, my husband and I will have a fight. Okay, even if you have to understand that there are some household dynamics. You have to understand that who are the ones earning money, who is the household head, and the household head usually gets the decision. And mothers sometimes stayed at home. They don't have like they were disempowered, so they cannot make the decisions for their children. They don't want to fight. And one of the among the major reasons we notice or emerge in our studies that there are several individual barriers. There are competing time demands Imagine children having 6 kids, and then a mother, and then her husband is at work, and then she's taking care of her 5 kids, and then it's a schedule, and then how can she go to the health center? Okay, there's also a view of vaccines as not as non-essential. This is particularly very interesting. You have to understand that the meanings of vaccine changes, and the narratives of vaccines has changes over time because of the scares, because of the vaccine rumors that evolves every year, like from the smallpox, from the tetanus, from the dengue, and then it does not stop. It just like go into the fertile soil and then will knock us off when it's time for them to like, oh, these are like rumors, vaccine, and like let's punch the government, the health minister to like question vaccine. And then there's also like religious or cultural edicts to dissuade vaccination. There were some religion who are like asking, oh, are there like, is that vaccines free of pork fragments or something like that? Is it halal or something? And then there's like this fear of new vaccines. These are interrelated, interconnected with the dengue. There's also, yes, of course, fear of side effects. And then there's like interpersonal and community barriers, like household or opinion leaders oppose vaccination. Okay, so policy implication is, are we developing an intervention addressed to these mothers or addressed to these household heads or opinion leaders or neighbors or who oppose vaccination? So you have to, policy-wise, we have to like really weigh in our pros and cons. And then health system barriers, this has been very sad, disappointing, frustrating when we analyze the data, that they lack trust to health workers in general. They hate the idea of them being dismissed whenever they ask questions about vaccines, about their conditions, and they feel that they were dismissed and they were embarrassed, that they feel that they were ignorant, that they don't understand, that they are not a good mothers, but they feel that because of that dismissal, because of that aggression or frustration, disappointment towards our healthcare workers, they really don't want to go back. They really don't want to get the vaccine, and which is sad. Okay. And then, of course, our superstructural barriers, natural calamities, COVID-19, and its associated lockdowns. Now, this is my last slide, so I don't want to like burden you all with my lecture, but I really wanted to have like a more time on question and answer. So the thing about the lessons learned that we took from our study is that we need to reshape a vaccine conversation. We need to listen with empathy. We need to, these mothers, these Filipino individuals need someone who really listens to them. And I have to be honest, in the beginning, in the rollout of COVID-19 vaccine, I was also, to be honest, I was also very hesitant to get COVID-19 vaccine. And it's okay. It's normal to be questioning because it's your body and you have to decide on your own. But what makes it for us healthcare workers is that we have some sort of we can get information. We can get trusted information. We can ask our colleagues or infectious disease doctors. We can ask our colleagues. Since we are in research, we are having this talks about, oh, this is the new study, this is the clinical trial results. So we understand. We were able to, we are in or what I mean, we are capable of understanding these numbers, these efficacy trial results. And you have to put your feet in the shoes of individuals who question, Is it okay? Is it good? So you have to listen to them. Ask open-ended questions. So what makes you fearful? Okay, so what can we do to alleviate your fears, your anxiety? So what makes you anxious of not getting the vaccine? And then they will start to like, because there were some news about Sinovac, and then there's news about this Pfizer, and then yeah, you are hearing a lot of narratives in the Facebook that why are they not giving Pfizer to us? We are paying also our taxes and so on and so forth. So you have to let them understand that all these vaccines were scrutinized, were studied by our experts in the panel. Okay, in order for these vaccines to be released as to the country, to our country, as good vaccines, they are being studied by our expert scientists. So you have to explain to them, and then make use of the opportunity, share trusted information, okay, and explore reasons for wanting to get vaccine. And then after that, okay, so why do you need to get vaccine? And then emphasize family dynamics. So because this is for my family, and this is like a hope for us. So these are the things that we need to underscore in reshaping our vaccine conversation. We are still on difficult times, but we are still on our way, like getting herd immunity and population immunity. So we need to, like, as soon as we are, and I mean, we are very fortunate with the WHO COVAX facility and the government, because our vaccines are coming in, and there are some news from the WHO that more vaccines will be coming into our country. So this is like a good news. So what we can do is try to engage with conversation with empathy. And I think that's one of my main takeaway today, is that vaccines in general are safe, effective, and free. So if you have a chance to get the vaccine, get an appointment and get the vaccine. And that, I think, thank you very much.
Thank you for that very informative and enlightening presentation, Dr. Reñosa. Maria, I would agree that from the presentation, Dr. Reñosa mentioned that certain controversies from a massive spread of misinformation have created this domino effect, which led to some decrease in the confidence of our general public when it comes to vaccine itself. Do you agree with that?
That's right. Actually, that's right, sir. And we as educators and health professionals, at the same time, I think we have a key role in helping the general public appreciate the benefits of vaccination.
Personally, Maria, have you ever encountered someone who is like hesitant in getting the vaccine?
Well, I have encountered a few, and I think their hesitancy, aside from those mentioned by Dr. Reñosa a while ago, came from the idea that vaccines have side effects, right? So people are afraid they may experience side effects from getting the vaccine. So since yun nga po, I'm a medical technologist and I know how vaccines work, I told them that vaccines do not contain live viruses. We will not get COVID-19 from getting the vaccine. And aside from that, these side effects, if there's any, are just mild and temporary compared to the COVID symptoms that we will experience once we get infected. And another is, right, tama yung sinabi ni Dr. Reñosa that uh, misinformation or social media platforms have been enormously influential in the spread of vaccine hesitancy. So the main issue here is misinformation.
Actually, you're right. And I'm afraid that this vaccine hesitancy may threaten our historical achievements, which are made to reduce the burden of infectious diseases. Like what Dr. Reñosa have mentioned earlier, vaccines are responsible for total eradication of like smallpox, and the elimination of polio worldwide. So we must revive the faith in vaccine to protect our future generations. But before we get deeper into this conversation, I would like to acknowledge, of course, the presence here among our panelists is Dr. Rosano Locsin, Professor Emeritus of Florida Atlantic University, Tokushima University. Dr. Locsin is a nursing theorist advancing the theory on technological competency as caring in nursing. Good day, sir.
Good day, sir. So maybe our participants have their own questions, right? So we'd like to encourage everyone to key in your questions on the comment or chat section in the lower portion of your screen. Just make sure to type in your name so that we can acknowledge you properly.
Speaking of participants, would like to greet our participants from the different parts of the Philippines and in the world. I have noticed our participants from Davao. We have from Sorsogon, Albay, Zamboanga, Negros Occidental, and yes, even from Japan and Oman, and I'm sure a lot of different areas in the world are also here in our participants. So before we get to the questions, we would like to have some refreshments, and may we all lend our ears for this presentation brought to us by the students of Cavite State University College of Nursing. Let's watch this.
Close my eyes and I can see what it's ready now for me. That I call my through the door, when no one's before. But it feels like home. They can say it all sounds crazy. They can say I've lost my mind. I don't care, just don't call me crazy. We can live in a world that we decide. 'Cause every night I lie in bed, the brightest colors fill my head. A million dreams are keeping me awake. I think of what the world could be, a vision of a one night stay. A million dreams is all it's gonna take. Oh, a million dreams for the world we're gonna make. Just a house we can build, every room inside is filled with things from far away. Special things that compare, each one there to make us smile on a rainy day. They can say it all sounds crazy. They can say we've lost our mind. I don't care if they call us crazy. I know each one of me is
Okay, before we go ahead and take some time for the questions, I would like to call in our first reactor for today. Our first reactor is one of the board of directors of the Philippine Association of Medical Technologists Incorporated, Cavite Chapter, and a faculty member of our Department of Medical Technology. Hello, Ma'am Kay, Miss Karen Krista Escobar.
Good afternoon, Ma'am Ria, and thank you for the very warm introduction. Am I loud and clear, ma'am?
Yes po.
Okay, so I'll begin po. Dr. Reñosa presented a very comprehensive lecture on how we can address vaccine hesitancy and bolster the vaccine confidence in the Philippines through a human-centered design approach in their Project Salubong. I agree with him that the vaccine is one of the world's leading public health achievement. Unfortunately, it's also the source of anxiety among families and individuals globally. As what the World Health Organization and our Department of Health accentuate, vaccines work to save lives. And through this vaccine, an estimated 2 to 3 million deaths are prevented every year. And moreover, this help limit the spread of antibiotic resistance by preventing the diseases in the first place. And by increasing immunization globally, an additional 1.5 million people every year could be saved. As mentioned by Dr. Reñosa, vaccine hesitancy refers to the delay in acceptance or refusal of vaccines despite the availability of vaccination services. And it is due to lack of 5 Cs that he mentioned, namely the confidence, the complacency, constraints, calculation, and collective responsibility. And currently, there's a limited guidance on how to successfully combat vaccine hesitancy, and most of them came from high income settings. The challenge is how can we convince the unconvinced so that they can be part of the beta vaccination for COVID-19 and our immunization programs, considering that the Philippines, our country, is included in the low and middle income countries. Why is it problematic in the first place? As mentioned earlier, these are due to high burden of vaccine preventable deaths, insufficient immunization structures, and outbreak containment difficulties. And yes, the Department of Health, allied health organizations, and other institutions work hand in hand in the information drive to correct those misconceptions or vaccine myths. However, as mentioned earlier, the vaccine confidence has fallen from 93%, meaning the strongly agreeing to the importance of the vaccine in 2015 to 32% in 2018. I would like to add that as of May 21, 2021, the Social Weather Station survey reported that 51% of adult Filipinos are confident on the government's evaluation of the COVID-19 vaccines. And of this number, 18% of the respondents said that they are very confident, and 34% are somewhat confident. And still, it's a very low, diba? So the Philippines now experience a lot of challenges in the immunization program, and thus lowers the confidence of every Filipino in the vaccines. In Dr. Reñosa's Project Salubong, they have applied the term salubong, which refers to welcoming someone back into one's life, Filipino tradition, to the vaccines itself. In this study, they use a human-centered design approach wherein they conduct in-depth interviews and focus group discussions in order to develop and pilot a health promotion intervention that addresses vaccine hesitancy via local narratives and empathy among families, policymakers, healthcare workers, community leaders, and community health workers. And due to COVID-19, some of their data collection were collected remotely. But this comes as a blessing in disguise, as their study will be the first to outline the opportunities and pitfalls of remote qualitative research. I agree that we should develop interventions that are tailor-fit to the concerned population, as they have different reasons why they don't want the vaccine. And we have that task to educate them. As mentioned by Dr. Reñosa, we should reshape vaccine conversations by listening with empathy, asking open-ended questions, sharing trusted information, and exploring reasons for wanting to get vaccinated. And as a public health professional, we can influence others starting from our home, listening to our loved ones on their concerns in vaccination, and giving them the facts about vaccination to regain their trust in vaccines so that they can now share the correct trusted information to their workmates, friends, and other networks. We should also share relevant information in our social media to help in regaining the public trust in vaccines, just like what we do in our organization, the Philippine Association of Medical Technologies Incorporated. As a faculty member in Cavite State University, we should be the one to vaccines and or the vaccination itself and share reliable information first our students as a role model to them, and we should also open our doors to future research. We should support health-related studies like these. We, in our growing family in Center, give services to fellow webinar series or one-on-one session or researchers. Overall, as a healthcare worker, public health professional, instructor, researcher, or in whatever field we have this. Further, this is a shared responsibility, a concerted effort among different sectors or levels in our society. That's all. Maraming salamat po at mabuhay po tayong lahat.
Thank you, Ms. Escobar. Our second reactor is Mr. Laurence Figueroa, a health education and promotion officer currently in charge of the COVID-19 vaccine advocacy and communications of the Provincial Health Office, Cavite. Good afternoon, sir.
Good afternoon. Am I loud and clear, sir?
Yes, sir.
Okay. Good day, everyone. As mentioned during the presentation, vaccine hesitancy is a major contributory factor in the low vaccination coverage, not only for COVID-19 vaccines, but also to routine immunization services for children. It is evident in the province of Cavite, the most populous province in the region, in which lack of confidence and fear in the vaccine attributed to the significant decrease in the immunization of measles rubella vaccine and polio vaccine and cause upsurge of morbidity and mortality cases of such infectious diseases. Two things I learned from the presentation: lobbying public health immunization services and advocacy. First, lobbying the vaccines, human resources, and logistical requirements in COVID-19 vaccination program to decision makers could enhance our vaccination situation by having enough vaccination sites and vaccination team which is of appropriate capacity and distribution to reach all eligible populations. Second, strengthening communication and advocacy campaign like Project Salubong, campaigns either in a group, interpersonal method, or digital platform is foremost in our battle against COVID-19 misinformation and in boosting confidence in these COVID-19 vaccines. Also, communication planning is vital to persuade the undecided and misinformed. It must have a clear, defined communication objective and key messages that address the following issues: how the vaccine works, the importance of clinical trials of these vaccines, and how it is regulated for quality, safety, and effectiveness, cold chain management of these vaccines, benefits of getting vaccinated in the middle of pandemic, potential side effects and how they are treated, what are the government support for severe adverse effects, and most importantly, the visibility of our leaders in the vaccination campaign. Our vaccination is a concerted effort. Let us always remember, time is the essence. The earlier we get vaccinated, the earlier we'll be protected. Let us stop the spread of the virus and prevent strong new variants by getting our vaccines once it's available. Wash our hands frequently with soap and clean water, keeping at least 1 meter distance from others, avoid unessential activities outside our home and work, and wear mask properly, covering our mouth and nose. Thank you.
Thank you very much, Sir Figueroa. At this point, I think let's now proceed to the much awaited open forum. Sir Louis, are we ready with the questions?
Yes, Ma'am Ria, I think we have some questions being raised in our Q&A button right here on the Zoom platform. Dr. Reñosa, are
Mhm.
we ready to
Yes,
some
sure.
questions? Let me just read them for you. Okay, first question is from Miss Maricel Abalona.
Mhm.
Her question is, how are we going to encourage everyone to have the COVID vaccine where in fact there was a news that 300 medical practitioners still became COVID positive even after completing the 2 doses of a vaccine? What is your take about this issue? Do we need to have the news blackout with regards to the side effects or after effects? Dr.
Mhm.
Reynosa.
Yeah, this is a very wonderful question. Amazing, amazing question. Um, Use blackout as a problematic approach, as it can uh, backlash and it can affirm the anti-vaccination sentiment that the government is sort of conspiring or sort of controlling people. So we have to not do that. Okay, we have to be open, be transparent that this is happening, and what we can do is to strengthen our health education post vaccinations, of focusing on post vaccination, is stressing that we after that we need 2 weeks after the second dose for us to be fully vaccinated. And also, it is not a guarantee that even if you are fully vaccinated, that you will not be getting COVID-19 again. You can, but what makes it's good is that if you are fully vaccinated, you will no longer get severe symptoms. You will no longer be intubated, something like that. So your chances is that getting mild symptoms. So I think the stress there is on health promotion, that even if you're fully vaccinated, you need to still wear masks. You need to adhere to the basic infection control procedures. Yeah. Okay.
Okay.
Should I read the questions,
Let
Carla?
me, let me read it for you, Dr.
Okay, perfect.
Another question is from Miss Gina Alvarado. There have been new cases of medical frontliners who have been fully vaccinated with Sinovac, yet are
Mhm,
suffering from severe symptoms of COVID. Does,
mhm,
does this
mhm.
prove the inefficacy of a Sinovac or just isolated cases?
Yeah, to be honest, I cannot really answer that question. But what I can say is that it's not a guarantee that after a second dose of vaccination that you are free from COVID-19. So we need to really stress on the importance of doing hand washing, doing basic infection control, and at the same time, there were lots of studies, like as I mentioned before, our panel of scientists who approved Sinovac, who approved other vaccines, Pfizer, Moderna, has studied the efficacy results. So meaning these vaccines, once out in the public, they are efficacious, they are safe. Yeah, thank you.
Thank you,
No,
Dr. Reynosa. Another question from Mr. Lemor Parian. Good afternoon. How can we as student nurses advocate for people, especially our families and relatives, to participate in vaccination programs using media and information literacy?
That's interesting, right? So as a student nurses, we are as early as your novice years. We are our professors, our instructors has already wired our mind to do tender loving care, to be empathic, to use therapeutic communication. So it's the perfect time for us to, it's a perfect time for you to really use those skills, especially that there will be more questions because you are healthcare worker, you are in line with health related course, so you are the perfect conduit to give that information. Yeah, with regards to the media and information literacy, you have to I think weigh in if your family members, if your relatives are really into like some sort of technical savvy or some sort of like that. So you can teach them. So yeah, and I mean what makes it really interesting now is that what 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 I think is important at this point is that you have to let them understand that there are several fake news outlets, there are several fake information, and then direct them to trusted information. So that's the key in addressing vaccine hesitancy. Yeah.
Thank you, Dr. Reñosa. Some of the questions, or there are a lot of questions being raised here in our Q&A button, and some of them I would assume are already being answered by the previous questions. So let me just select a few more. Here's from Miss Marina Magdalena Nobla. She's sharing her congratulatory message for you, Dr. Reñosa. And her question is, I gather that this is a qualitative research, and one of the challenge is the question of validity and reliability vis-a-vis the rigors of the study. I would like to ask, how did the research team dealt with their preconceived biases in relation to the conduct of the study?
Oh yeah, thank you very much, Dr. Ninobla. Dr. Ninobla was my classmate in my Doctor in Nursing Science in the Philippines, St. Paul. It's a very nice question, wonderful question, Dr. Ninobla. Actually, there is like, remember, there's always in qualitative research, there's a concept of reflexivity. So we have to, reflexivity defines as something that we as qualitative researchers should acknowledge. Like when we do analysis of our data, we acknowledge our preconceived biases. So if you will be doing like phenomenology, you can do some sort of bracketing or just sort of journaling. And what we did in this project is we usually conduct, after each interview, we usually conduct systematic debriefings with all of our study teams, and then talked about what made you feel, how did you feel that you were talking more, or you were inputting much into the discussion, or you're just letting participants emerge, or letting the participants talk and discuss their stories. So these are the things that you need to put in or take down notes, so that after the completion of your data collection, you are side by side, you are doing, you are trying to when you analyze your data, it's like, okay, is this what the data speaks about, or is this me talking? So there's like a sort of check and balance. And at the same time, it's also important that a collaboration. We are moving away from a single researcher now. We are moving towards a collaborative approach, like collaboratively working on a different fields like social science, anthropology, and so on, for us to really understand and for really understand the depth of the lived experiences or the phenomenon of your study of interest. Yeah, so reflexivity is the key.
Thank you. Here's another question, Dr. Reñosa. From Mr. Roy Linaw of Davao City. According to him, there are hearsays that those receiving Sinovac cannot gain entry to some countries. Personally, I have read about this. I think it's on the European Union. They are recognizing only four brands, which are, I think, the Pfizer, Moderna, AstraZeneca, and J&J.
J&J, yes.
And
Yeah, that is true. That is
which
true.
relates why most people would prefer to have one among those four. Any comments about that, please?
Yeah, we have to acknowledge. We have to acknowledge that the European Union really have like this so-called vaccine passport. It's actually not yet implemented, but they are talking about vaccine passport now. So yeah, me, I'm a proud Sinovac vaccine recipient. So when I arrived here in Germany, they were actually not like you are being banned or something. It's not the main takeaway of that. Is that if you receive the four vaccines, that specific Pfizer, Moderna, J&J, and and AstraZeneca, you are actually not required. I know because I don't know now because like the policies changes every day. So you are not required to do like your quarantine. But if you receive your other vaccines, you're still allowed to come in, and you just have to do your 10 to 14 days quarantine. So yeah. So I think that's a valid concern, but there are some talks now. Sinovac has been approved by the World Health Organization, and the European Union is actually now started their evaluation of the Sinovac results. So, but that does, we should not think about that like traveling. You can still travel. Germany for I think this next spring or this summer, they will be allowing tourists to come in. But if you receive like Sinovac or other vaccines, you just do your quarantine. It's fine. Yeah.
Thank you again, Dr. Reñosa. And as much as we would like to address all the questions, due to time constraints, I guess we're going to be down with our last question.
Mhm.
Okay, this comes from an anonymous attendee. Hesitancy to anything new in particular is normal, considering the culture that is inculcated in every Filipino. In your opinion, how can we make more people listen to vaccination importance and correct the misinformation they previously believed in? And how can the youth, which comprise majority of the population, help in reducing vaccination hesitancy?
Mhm. So I think it's a very very good question. So I would rather because during our interviews in our Salubong project, we focused on also the different stakeholders. We focus on healthcare workers. We focus on parents who were vaccine refusal. So one of the major salient theme is that the vaccine hesitant families were dismissed, and they feel ignorant because the healthcare workers, because sometimes we tend there are, I know we were wired to be therapeutic and all, but you have to understand the dynamics in health centers. People coming in, long lines, several, and then health workers are not just doing this vaccination project, they are doing several projects along the side. So you have to understand that these are structural dynamics in health centers. So sometimes when vaccine hesitants like ask questions, we tend to like, because we're tired, we tend to like dismiss. You're wrong. This is not the thing. That's fake news and all. And we should, as healthcare workers, we should not do that. We should not be dismissal. We should not dismiss those ideas. We have to anchor, or we have to understand where they are coming from. Okay. And there's a point in our data analysis, like in the intervention development, we were like thinking, paano ba? Magbibigay pa tayo ng mas madaming impormasyon? Kapag ba may hesitancy, bubugbugin ba natin yung nanay ng impormasyon? Ito, measles vaccines, ganito yan. COVID-19 vaccines, ganito yan. You have to understand that hindi na nila mapaprocess yon because they are takot. Takot na sila and they are in a state of panic, they are anxious. Imagine yourself in an anxious state and then someone is lecturing you with those kinds of information. Hindi na papasok sa iyo yon. So what we do is sit down, try to understand where they are coming from, paano nangyari, paano siya naging anxious. And at some point, then, pag na-understand na natin yon, then we can develop proper intervention. We are looking at several ways on how to, so our intervention comprises of a video animation. So, and at the same time, we are planning to train our healthcare workers in some sort of motivational interviewing. It's called motivational interviewing. This is what other countries are now doing in the high-income countries, wherein the healthcare workers, the doctors, the nurses are now trying to be conversant. Do you want vaccines? So what are your fears with vaccinations? And so forth. So this is like some sort of a conversation to ease the anxiety of the parents and at the same time make them, like, nudge them on the right decision, like right decision making. Yeah.
Thank you, Dr. Reñosa. I believe that Dr. Reñosa at this point would still very much interested to answer all the questions. So I guess on a different platform, Dr. Reñosa will be very much welcome to answer all the questions. But as we move forward, Ma'am Ria.
Okay, again, thank you, Dr. Reñosa. At this point, we would like to award the Certificate of Appreciation to our webinar speaker and reactors.
Allow me to read the certificate. First certificate of Appreciation is hereby awarded to Dr. Mark Donald Reñosa for sharing his valuable knowledge as presenter in the FiND webinar series, The Viral Spread of Vaccine Hesitancy, Building Vaccine Confidence via Empathy and Narratives in the Philippines, held on 19th of June 2021. Signed, Professor Violeta A. Lopez, President and CEO of the Filipino Nursing Diaspora Network, and Dr. Evelyn M. Del Mundo, Dean, Cavite State University College of Nursing. Thank you, sir.
Thank you very much.
And of course, for our webinar reactors, Certificate of Appreciation is hereby awarded to Mr. Ralph Laurence A. Figueroa and Ms. Karen Krista M. Escobar for sharing their knowledge as reactor in the FiND webinar series, The Viral Spread of Vaccine Hesitancy, Building Vaccine Confidence via Empathy and Narratives in the Philippines, held on June 19, 2021. Signed, Professor Violeta A. Lopez, President and CEO of the Filipino Nursing Diaspora Network, Dr. Evelyn M. Del Mundo, Dean, Cavite State University College of Nursing. And at this point, I would like to invite all our panelists to turn their cameras on, to turn their videos on for a photo opportunity. Okay, let's have a screenshot, Sir
Please stop
Ivan.
screen share.
I guess we would like to have the first slide for the screen.
I'll just go
Diba?
back to...
Thank you. Everybody loves the screenshot. This is the most awaited part sometimes after the talk of our guest speakers. Sir Ivan, on your cue.
All right. Okay, thank you. Okay, in three. Okay, in 3, 2, 1. Smile. Okay, one more. Okay. In 3, 2, 1. Okay. Last page. Okay. 3, 2, 1. Smile. Okay. Very good.
Thank you very much, everyone, for sharing your lovely smiles with us today. And Ma'am Ria, can we fully show the PowerPoint? All right. And at this point, I would like to call in the Director for Development of the Filipino Nursing Diaspora Network. For our closing remarks, help me welcome Dr. Cindy Lay. Good day, Dr. Cindy.
Hello, everyone. Okay. I am Dr. Cindy Lee. I'm the Director for Professional Development of the Filipino Nursing Diaspora Network. I think everyone will agree that today's webinar is a great success, starting from the warm welcome message of President Robles, the opening remarks of Dr. Talaktak, and a very fitting introduction to the achievements of our guest speaker by Dean Del Mundo. Our resource speaker, Dr. Reñosa, gave a historical account of vaccine confidence and hesitancy in the Philippines. His extensive knowledge of the context and circumstances surrounding the incidents and events in all the different stages is very impressive. And he also clearly articulated his research, Salubong, on viral spread of vaccine hesitancy and the effective strategy of building vaccine confidence via empathic narratives. I have to point out that I think he was able to capture our interest and allow us to get a clear understanding of the presentation due to his very engaging and conversational manner of sharing his experiences and expertise. He did this during the presentation, but even as he responded to the questions. I also wish to highlight the incisive and insightful responses from our two reactors, Ms. Escobar and Mr. Figueroa. Okay. I will be remiss if I didn't mention the contribution of each of the key members of the organizational committee for the webinar. Great work, everyone. So, on behalf of Dr. Lopez, the president of FiND Network, and the executive director and advisor of FiND, Mr. Jerome Babate and Professor Nino Locsin, I thank everyone for your participation in today's presentation, and I sincerely look forward to many more interactions with all of you in the future. Thank you.
Thank you po, Dr. Lee. So before we formally end this webinar, let me just leave this concept. Vaccines cannot work alone. Vaccines will not shorten the pandemic unless we, the public or the community, will embrace and will agree to receive them, right? So again, we are very thankful to see and know that all of you are here with us today. And thank you, everyone. We greatly appreciate all of you for joining this webinar. So at this juncture, we would like to take the following. Cavite State University Administration, headed by the Fast and the Serious University President, Dr. Hernando D. Robles, Filipino Nursing Diaspora Network. Thank you very much po, Dr. Violeta Lopez, Dr. Cindy Lay, and Sir Jerome Babate for hosting today's event and partnering with us. It's always a pleasure.
Again, thank you all for attending this international webinar. We do hope that you have learned so much and looking forward to another relevant and informative webinars.
Until the next webinar, again, this is Ria Maris Matel.
And I am Luis Carlos Roderos. Have a good day and stay
stay
safe,
safe, everyone.
everyone. Would like to remind everyone that the evaluation link can be found on our chat.
on our chat